East Africa, the HIV pandemic is no longer a death sentence, but it is far from over. While global conversations may have quieted, communities are still grappling with the realities of one of the deadliest viruses in modern history. My name is JD Odinga and welcome to In Focus, an EAMG TV special bringing you a deeper look at HIV in Africa, the challenges, triumphs and the cutting-edge hope now emerging. According to the Joint United Nations Programme on HIV and AIDS, over 20 million people are living with HIV in sub-Saharan Africa, and East Africa carries a significant share. Kenya, 1.4 million people live with HIV, Uganda, about 1.3 million, Tanzania, roughly 1.7 million, and Rwanda, just over 210,000 people. While new infections have dropped over the last decade, thanks to education, prevention, and treatment, progress is uneven and threatened. Just as progress seemed irreversible, a sweeping policy shift in the US changed everything. On January 20th, 2025, Executive Order 14169 froze virtually all foreign aid for 90 days, halting disbursement and pausing programs including HIV prevention pending review. While a waiver allowed life-saving HIV medication to continue practice, PEPFAR services didn't fully restart, especially prevention like PrEP for key populations. Reports estimate thousands of deaths and new infections, with UNAIDS warning 2,300 additional HIV cases per day globally. Though the US Senate later blocked a proposed $400 million cut to PEPFAR, the broader damage for funding and health delivery systems remains deep. One of the biggest challenges: access. In rural areas, the nearest clinic could be hours away. In urban centers, stigma still silences voices, and for young women, especially girls aged 15 to 24 years, the risk remains alarmingly high, with new infections occurring at rates 3 times higher than in boys of the same age group. And yet, amid uncertainty, hope arrived in Kigali, Rwanda.
Every day, I laid out my father's pills and made sure he took each dose. I didn't know he was dying of AIDS. I just knew his medicine mattered. It was a ritual of love, responsibility, and resilience. Look at this pattern. Every shape, every pill tells my story. Since those dark days, millions of lives have been saved, including mine. Today, HIV can be prevented. It can be treated. We are so close. And now, I am a mother. I say to the world, we cannot stop now.
At the 13th IAS Conference on HIV Science that took place in Kigali, over 4,000 delegates gathered as science raced ahead while funding stalled. The World Health Organization revealed new guidelines recommending lenacapavir, a twice-yearly injectable PrEP. Data from large phase 3 trials, PURPOSE 1 and 2, showed 99.9% to 100% effectiveness across diverse populations, calling it the closest option to an HIV vaccine, ideal for populations struggling with daily pills.
And we are proud and pleased to be supporting the 8th Global Fund replenishment alongside the Republic of South Africa later this year. And we're looking forward to working with an expanded network of partners to end the public health scourge of AIDS, TB, and malaria. From the beginning of the Global Fund in 2002, the UK is proud to have played its part in supporting the fund, helping to reduce infections, save lives, and cut the death rates from AIDS and TB and malaria by 63%. We've been the 3rd largest donor to the fund, pledging $8 billion since the beginning. And we are committed and convinced that our support to the fund continues to represent an excellent use of development assistance. Every dollar spent on support to the Global Fund results in $19 in return in terms of global health and economic returns. Here in Rwanda, I'm sure we'll hear more about the achievements of the Global Fund during the course of today's event. But we know that the Global Fund investments in Rwanda have helped on HIV to ensure that 95% of people know their HIV status and over 90% of people are virally suppressed, that for malaria, they've supported the distribution of over 6 million insecticide-treated bed nets, and they're supporting TB treatment with an 87% success rate. Now, I think what has also been a hallmark of the Global Fund support to Rwanda has been the investment in health systems, and I think this gets to your point, Eugene, in how we ensure alignment of global health instruments and donor support behind country-led health systems. Many of us may have been at one of the pre-conference sessions yesterday for the International AIDS Society conference on the current funding situation, the uncertainties in that, and how to sustain the gains that we've made in HIV prevention and treatment. And I think key to that solution is investment in health systems, integration of the disease programs into nationally led health systems. So for Rwanda, the Global Fund has, for example, supported the integration into primary health care through the community health management model, supporting community health workers, and also supporting the development of information systems through the DHIS2 Health Information Management System, and support through the Digital Health Impact Accelerator. And I'm really pleased to learn that Rwanda has also been the home for the Health Tech Hub Africa, supported by the Global Fund, bringing together health innovators on health information systems. It's precisely these kinds of investments in innovation which will help drive better efficiencies in the disease control programs, making them more affordable and more able to integrate internationally led health systems. For us, it's important that this year's replenishment of the Global Fund is successful, and therefore we do welcome the early pledges from Norway, Spain and Luxembourg, as well as some of the Global Fund's long-standing private sector partners, the Children's Investment Fund Foundation and Takeda Pharmaceutical. It's a great start, but it's important that we carry this momentum forward. So we call upon investors, both long-standing and new donors, to stand firm in their commitments and to demonstrate solidarity in support of global health and in support of multilateralism. We recognize also the important role played by civil society and communities in fighting infectious disease and ensuring health equity. And we commit to preserving their central role in global health multilateralism to ensure that we leave no one behind. I think one of the key messages from yesterday's pre-conference sessions was, as we move to integrating disease control programs into healthcare systems, it's important that civil society is able to play its role to ensure that key populations that may suffer from stigma are still able to have access to services. Finally, we must also continue to innovate and harness new tools to prevent, diagnose and treat the 3 diseases. There's a lot of excitement at the conference about the potential for the long-acting PrEP, but it's important that the innovations such as long-acting PrEP are able to be brought into health systems, and that's why donors such as the UK have an important role to play in supporting organisations such as Unitaid, such as CHAI and others, to ensure that those innovations are able to be drawn as quickly as possible into health services. Finally, I think what was key from yesterday's discussions, and what I'd like to end on, is that it's essential that health systems are nationally led, and that those nationally led, government-led health systems are able to bring the disease control programs in and integrate them into healthcare at different levels, and crucially at the primary care level. And I think it's important for us as donors to ensure that we are supporting those nationally led health systems, because that's the way that we're going to achieve sustainability in what is currently an extremely volatile context.
The heartbeat of the partnership is not just government, it's not just private sector, it's not just donors, it is the communities who asked that we believe in solidarity. And many of us did believe in solidarity, and we still believe in solidarity today. That is the first thing that I think must be remembered in thinking about ways in which communities have taught us that we can come together under very important values of solidarity and believing in multilateralism, that it can work. That not one country can get us to 2030, not one donor can get us to 2030, not one community, but together. That togetherness is needed today. And I say it in the context knowing that many countries are going through a very painful process of readapting, changing, reprioritizing Grand Cycle 7 midway. It is very painful. It's painful for me as a person living with HIV. What do you keep and what do you not keep? Because all of those priorities were priorities already. I cannot come here and say which community interventions are more important and which ones are not important. All of them are important. They have led to me being undetectable after 21 years. They have led to me having 2 beautiful negative children. One is 18, the second one is 12. My husband remains negative. All of those interventions together, not one, not the other, together. I just want us to remember that we need all of those interventions. I don't want to pick on one because I understand my positionality right now is a very sensitive one. I'm going to look like I'm asking you to safeguard community interventions. I don't want to fall in that trap, not sitting here in Rwanda right now. So can you allow me to not mention interventions? I know it's going to be very difficult. But I want to say that the partnership has been very instrumental for Africa. Since we are sitting in the soil of my birth, we've saved 12 million lives because of the partnership. Just in Africa, out of the 25 million lives saved, 12 million were in this region. If we didn't come together with all of us together, those lives, including mine, wouldn't be here. Can you imagine the depression we'll be sitting in 2025, looking back and saying we could have done something? And we did. And we cannot then afford to throw that game. We cannot afford to slip back. And I'm not just talking about gains in HIV, gains in malaria, gains in TB that we've made. Yes, this is an HIV conference and we are centering the impact in HIV. In Rwanda is really a trailblazer for Africa. Having reached reduction of 71% new infections is a huge achievement for an African context that has went through so much turbulences. That is things to be celebrated. But Rwanda is a trailblazer, and there are many countries who have uneven progress behind Rwanda. We still are facing a lot of challenges, and here I want to highlight 76% of people living with HIV in Africa that are struggling to be virally suppressed. Of those, children, we will be judged by the future by what we did for our children. We, all of us, promised that we want an HIV generation that is free of HIV. I don't think we are doing enough. We are not doing enough. It's a shame on all of us, and I'm saying it, that we center children in the replenishment, that we need to make sure that in 2030 we have 0 new infections, 0 deaths. Children need access to medicines urgently. They cannot wait 5 years like adults. Not that adults should wait 5 years either. But we are failing on children. And I don't want to mention many other failures, but children is one of the key things that we need to judge ourselves as the region and even the partnership to say, in our lifetime, we were able to eradicate HIV infections and mortality in children because of HIV. It can be done. We have all the tools. And I think Rwanda might lead us on this one, because Rwanda has showed us that with the resources they're getting through all of the partnership and even outside the partnership, bilateral relationships, they really have strengthened their health systems, included communities in their responses. They are integrating health services, making sure that everybody has access to services. It can be done anywhere else in the region if it can be done in Rwanda. Your resilience systems have shown that when pandemics hit you, as they did recently, the systems responded. You were able to avert deaths that could have happened if you didn't have resilient systems. So by investing in those resilient systems, we have proven that it is important that we remember that we're not just doing parallel systems, we're strengthening the core of the systems. That's why the Global Fund is needed, to still soldier with countries who are on the path of progress, like Rwanda, so that Rwanda doesn't fall back because of limited resources. I want to also end by saying, all of this, what I'm saying, it is at a big risk, it is fragile. If we don't have a successful replenishment, and thanks to South Africa and UK government for stepping up. You stepped up at a very politically difficult time. I don't want to mention the things that you may have to be challenged with because you raised your hand at the time when many governments possibly did not want to be seen. You wanted to be seen. You wanted to stand with people and saying, we will host the replenishment at a very difficult time. And we want to acknowledge that type of leadership and many other countries who are behind you in that core. But the test of that leadership is going to be what becomes the success or the outcome of the replenishment. All we are asking is 3 things. Help us to save 23 more lives, 23 more million lives, because our work is not done. Help us to prevent 400 million infections. Help us to avert 64% mortality that is preventable because we have the tools. Before I come to the 18 billion, that's what matters to me. It's the people who have a face that looks like me. It's the children who have a face that looks like me that we need to remember. That's why you have stepped up as UK, South Africa, you have stepped up. I want us to remember that the replenishment is not just money hoarded in Geneva. It is money that goes to countries and support countries in their vision for 2030. And 2030 is reachable. I think it's in sight. With things like lenacapavir, cabotegravir, we have tools that can help us avert infections. But it depends, what do we do now? We are at a crossroad, at a turning point. What are we going to do in 2025 that takes us to 2030? And I think the answer is in the room. The commitment is in the room, is what do we do outside to make sure that we can do what we need to do to get us to 2030.
But experts warned, innovation must be matched by equity. Without funding and political will, even the most effective tools won't reach those who need them most. Rwanda, however, stood out for achieving UNAIDS 95 to 95 to 95 targets thanks to political commitment and community-centered action.
Moving forward, as UNAIDS, we will continue to be a key partner within the ecosystem of Global Fund. Grant implementation, whether it's with communication with the Global Fund country team, whether within the country coordination mechanism, with the principal recipient, with the sub-recipients, with the implementation partners. We will continue to be at the heart of that, to influence decisions, to make sure communities' voices are heard, to ensure that issues on equities are addressed and access to services is available.
And beyond celebration, concrete steps were announced. Global Fund procurement agreements plan to begin rolling out lenacapavir in Africa by 2026. Science is advancing, but the political winds have shifted. In 2020, during the Trump administration, ships carrying essentials ARV intended for Kenya and Uganda were delayed at ports, jeopardizing treatment for hundreds of thousands due to policy constraints tied to US foreign aid. The World Health Organization has been instrumental in pushing for universal health coverage and access to life-saving antiretroviral therapy or ARVs. Their efforts support early testing, prevention of mother-to-child transmission programs, and training frontline health workers. Did you know East Africa once had one of the highest HIV rates globally, and today some of the biggest success stories? Rwanda leads in viral suppression rates with over 90% of patients on ARVs having undetectable viral loads. Uganda pioneered the ABC approach: abstain, be faithful, use protection. Kenya has introduced HIV self-test kits in vending machines in some urban areas. Still, access to innovations like lenacapavir remains an uphill battle. Gilead's list price in the US is $28,218 per person per year, far beyond reach in East Africa production in low-income countries. Economic models suggest that generic production could bring prices down to $25 to $80 per person per year if scaled to millions of users, cost-effective for East, Central, and Southern Africa. The fight against HIV is not just about medicine, it's about dignity, access, and sustained global cooperation. The progress made in East Africa proves that change is possible, but it must be protected and, most importantly, funded.
That everything is at stake. I think it was put very clearly. None of us want to go back to the dark ages of pre-Global Fund era. Some of us, without revealing age, were there at the time, and people living with HIV were dying left, right, and center, and it was a death sentence. And beginning of this year, when we all started hearing about these cuts, these images came back to us, to be honest. We are really being haunted now and scared with going back to that very dark era. So we're really all on edge. My executive director called it, beyond being just a funding gap, it's a ticking time bomb. What we are in today is a ticking time bomb, and I think that really explains it very well. So we don't have much time. Countries like Rwanda, having gone so far and achieved so much, now having to prioritize and to pick and choose where to allocate the funding, how to save lives, and obviously treatment and ARVs are priorities. But new infections are also priorities. So you cannot ensure everybody has access to ARVs, but do not close the gap, the tap on new infections. So everything is at stake. It's now time for us to think strategically, and we cannot continue to say we will do more with less. That doesn't work. We need to see what we need to do and do it efficiently and effectively. So the 23 million lives is not a small number. As was mentioned, these are women, these are girls, these are children. And we are accountable and responsible by 2030 to say, as partners, as stakeholders, what we have done differently. Today, as we stand in this crisis, what have we done differently to make sure that none of the populations that we serve, none of the communities that we serve are affected negatively. So that's not even an option for us, to stand and sit and do nothing about it. So the Global Fund aid replenishment is coming at a time that, it will be the lifeline, to be honest. It's the lifeline for those communities that have started on ARVs, communities that have started to lead responses and show impact and results, and all of a sudden now are being abandoned and left behind. So it's a deal breaker, the Global Fund aid replenishment. So we don't have the choice. We have to work towards full replenishment. We know the numbers, they were mentioned very, very eloquently, and we know the impact and the results. We were talking about the last mile to end AIDS for the next 5 years. Certainly for Rwanda, that was the case. Now it's not the case. Now it's about preserving the status quo if we can. You know, we are all in emergency mode, in crisis mode. We need to lift ourselves out of that crisis mode and see what we can practically do to move forward. I salute the government of Rwanda for immediately picking up and allocating local resources from the current fiscal year's national budget on ARVs, and that's just to start with. I'm sure we will see more, but that's not enough. That's locally excellent, but globally, and I know the word global solidarity is overused, but unfortunately diseases like HIV are global diseases, and no one's safe until everybody's safe. That's what we used to say for COVID. It still holds relevant for HIV. So global solidarity, the global shared responsibility at this point of time is more critical than ever before.
And this story is still being written. This was In Focus, where stories of struggle meet stories of hope. Until next time, stay informed, stay engaged, and stay in focus.